May is National Stroke Awareness Month, and strokes can happen to anyone at any time and is the second leading cause of death in the world. Joining us today is Dr. Karan Topiwala from Sanford Health, and he's going to tell us a little bit about why this is so important.
You know, stroke is, for every 40 seconds, somebody in the US suffers from a stroke, and every 3 minutes, somebody dies from it. So it is a big socio-economic burden. What's most concerning is that about a third of these patients who succumb to stroke are under 65 years of age. So you can estimate the impact it has on the society at large.
Yeah, so it's not just, an older population, it can really happen to anybody.
Oh, absolutely. Yeah.
What are maybe some things to look out for as far as, symptoms for maybe men or women? Is there different symptoms for each?
Yeah, so, stroke can cause a variety of symptoms. There's a very good mnemonic to remember for most folks to remember. So it goes as something like be fast. The B in it stands for balance. So if somebody suddenly loses their balance as listening to a side, the E is for eyes, sudden onset of double vision or loss of vision. The F is for face, so tingling on the face or drooping on one side of the face. A is for arms, weakness in your upper or lower extremity. S is speech, so sudden onset of slurring of your words. And then T is time, and I would say the T is the most important piece of it, because time really is brain. Every minute that somebody suffers a stroke, they lose approximately 2 million neurons. And so the faster somebody recognizes it, and the faster we can treat them, the better the outcomes.
Yeah, I guess what are some things that you recommend that people do maybe to kind of be prepared for this or prevent or in a meeting like that?
I think recognizing the symptoms of stroke and talking to your family members about what those stroke risks would be, especially if you're somebody who has some of the high-risk conditions for stroke: high blood pressure, diabetes, high cholesterol, abnormal heart conditions or rhythms called atrial fibrillation. If you have any of these diagnoses that you're aware of, be aware of the symptoms yourself, but talk to your family, your spouse, your children. So if you're suffering from that, they can recognize it and call 911 as soon as possible.
And how important do you think it is then to raise awareness for this month for strokes and just talking and having that conversation?
It is absolutely key. It is. I continue to see patients who feel that the tingling on their face is just something that's just going to go away, and they tend to wait an hour or 2 hours, and the first 3 to 4 hours of symptoms is really where if doctors get to give the right medications and do the right interventions, people will go home the next day. They can go back to their life. But if there's a delay by even a few hours after the symptoms start, that can really affect how long-term recovery looks like. And so talking about it really does make a big difference.
Yeah, and it can kind of be, like you said, maybe on a scale, like there could be, strokes kind of vary, is that correct?
Absolutely. So, there are also strokes that people can have and not realize they had a stroke until they get a scan later in life for, say, a headache, and I see that they've had a stroke. So it can be dramatic, where you can't move one side of your body, you can't talk, or it could be really subtle, like just a subtle loss of your balance or a subtle double vision. And so being cognizant, especially like I said, if you have a high-risk condition, high blood pressure, cholesterol, diabetes, be in tune with your body is telling you, and talk about it to your family. So, because they are the ones who are going to recognize that, your colleagues, your co-workers, and that does make a big difference.
Awesome. Well, thank you so much for being here this morning and
You're most welcome.
talking about this topic with us.
Of course.
And we'll be right back after the break.